Hello, my name is Rafael Duque and I'm reporting from my house. Today I'm going to talk about coronavirus. Coronaviruses are an extensive family of viruses that can cause diseases in both animals and humans. In humans, several coronaviruses are known to cause respiratory infection that can range from the common to more serious illness, such as Middle East Respiratory Syndrome, best known as MERS, and Severe Acute Respiratory Syndrome, better known as SARS. The most recently discovered coronavirus causes coronavirus disease COVID-19. COVID-19 is the most recently discovered infectious disease caused by coronavirus. Both this new virus and the disease causes were known before the outbreak in Wuhan, China, in December 2019. Currently, COVID-19 is a pandemic that affects many countries around the world. The symptoms you can get are fever, dry cough, and tiredness. Other less frequent symptoms that affect some patients are itches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, and skin rashes or color changes on the finger or toes. These symptoms are usually mild, and being gradually, some of the infected people only have very slightly symptoms. Most people, about 80%, recover from the disease without the need for hospital treatment. About 1 in 5 people who get COVID-19 end up with severe condition and experiencing breathing difficulties. Older people are those with previous medical conditions such as high blood pressure, heart-lung problems, diabetes, or cancer, are more likely to develop severe conditions. However, anyone that can get COVID-19 and become seriously ill, people of any age who have a fever or cough, who are also breathing hard, feeling chest pain or tiredness, or having trouble speaking or moving, should seek medical attention immediately. If possible, it is recommended to call the healthcare professional or medical center first so that they can refer the patient of the appropriate healthcare facility. What to do if you have mild symptoms, such as mild cough or fever? You generally don't need to seek for medical attention. Stay at home, isolate yourself, and watch your symptoms. Follow national guidelines on self-isolation. However, if you live in an area with malaria or dengue, it is important that you do not ignore fever. Seek medical help. When you go to the health center, wear a mask. If possible, stay at least 1 meter from others. Do not touch surfaces with your hands. In case the sick person is a child, help him to follow this advice. Seek medical attention immediately if you have trouble breathing or feeling chest pain or pressure. How is COVID-19 spread? A person can get COVID-19 from contact with other that is infected with it. The disease is spread mainly from person to person through droplets that fly out of the infected person's nose or mouth by coughing, sneezing, or talking. These droplets are relatively heavy, do not go very far, and fall quickly to the ground. A person can contact COVID-19 by inhaling droplets from a person infected with the virus. This is why it's important to stay at least 1 meter away from others. These droplets can fall on objects and surfaces around the person, such as tablets, knobs, and railings. So other people can become infected if they touch those objects or surfaces and they touch your eyes, nose, or mouth. Therefore, it is important to wash your hands frequently with soap and water or with alcohol-based disinfectant. Who is studying the ongoing investigation into the ways when COVID is spread and will continue report on the conclusions when being done? What does it mean to isolate yourself? Isolation is an important measure that people with symptoms of COVID-19 take to avoid infecting others in the community, including their families. Isolations occur when a people who has fever, cough, or other. Can children or teens get COVID-19? Researchers indicate that children and teens are as likely to be infected as any other age group and can spread the disease. The evidence to date suggests that children and young adults are less likely to develop a serious illness, but serious cases can still occur in these age groups. Children and adults should follow the same parenting and isolation guidelines. If there is a risk that they have to be exposed or if they have symptoms. It is particularly important that children avoid contact with older people and with others who are at the risk for more serious illness. Thank you, and remember, stay at home. Bye.